Thank you, Alan. With case numbers rising, the state health department is reminding us of all the measures that can help protect us from COVID.
Social distancing, mask wearing, and getting vaccinated. This comes as hospitalizations are reaching levels that we haven't seen all summer. The number of people hospitalized due to COVID is over 600 now. Currently, 612 COVID patients are in our hospitals. Last time we saw those numbers was mid-May. Children are among those being hospitalized now with COVID. But as the number of our kids with COVID increases, so does the number of kids with respiratory virus, or RSV. CBS 4's Karen Morfitt joins us live from Rocky Mountain Children's Hospital. And Karen, they want, of course, to be prepared for everything and anything.
That's right, Karen. And the doctor we spoke with today says if there's one thing that they've learned over the last year and a half, it's to plan long before those numbers start to reach any sort of peak. And that's what they're doing right now to avoid any sort of capacity concerns in the future.
Colorado doctors say they are starting to see more kids with COVID, in line with a wave of new cases being reported across the U.S. because of the Delta variant.
Not near the increase that we're seeing in other parts of the country yet.
But Dr. Reginald Washington, the chief medical officer at Rocky Mountain Hospital for Children, says they're planning for an increase.
We know that when there is a surge, that's not the time to begin planning.
They're upping capacity as far as staff and bed availability. And while it will help with any COVID surge, they're having to respond to a spike in a second respiratory virus, RSV.
I would say we have 2 to 3 times more children now with RSV than we did a week ago.
RSV is seen every year, but typically in the fall. Doctors believe the early spike has a lot to do with our pandemic protections.
We think there was very little RSV last year because kids were not out and about. They wore masks, etc. Now they're being more exposed to each other.
Despite having both viruses surging at the same time, Dr. Washington believes preparation will be key. Their real concern, he says, is for parents.
Parents are going to have difficulty saying, is this RSV or is this COVID? And I would discourage parents from trying to make the diagnosis.
Now, symptoms for RSV do mimic those of COVID. They include difficulty breathing, vomiting, and headaches. The doctor, you heard him there, he says don't try and diagnose this yourself, but get medical attention or seek medical help right away. For now, we're live in Denver. Karen Morfitt covering Colorado First.
Thank you, Karen. New tonight.